So I'd like to acknowledge the traditional owners on the land in which we're meeting today and pay my respect to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people who might be with us today. I'd like to extend a warm welcome to Dr. Amy Dennett. Dr. Amy Dennett is an Australian Physiotherapy Association titled Cancer Physiotherapist and Victorian Cancer Agency Research Fellow at Eastern Health and La Trobe University. She completed her PhD in 2018, which focused on improving physical activity levels of cancer survivors through cancer rehabilitation. She uses her research to improve the access of exercise and physical activity support to people with cancer to improve their health and well-being. She has been instrumental in shaping cancer rehabilitation services across Victoria, including leading the development of services at Eastern Health, St Vincent's Private Hospital, Melbourne, and Peter MacCallum Cancer Centre. Amy is also the creator of the Cancer Exercise Toolkit, a website housing resources for patients and health professionals on exercise, rehabilitation, and cancer. Over to you, Amy.
All right, thanks for the introduction, Alison. Good to see there's a familiar face on the line as well. So, yeah, thank you all for coming along today. So I'm going to talk to you a little bit about getting started with exercise before, during, and after cancer, acknowledging that many people on the line might be at different phases throughout your treatment. I had intended for this to be a little bit interactive, and I put a thing to do a word cloud, and technology is not cooperating today. So we'll just kind of see how we go. So just before I start and share the screen, just to get an idea of how many of you currently do regular exercise. If you want to just put a little reaction on a thumbs up or whatever if you are. Yep. Excellent. Which is pretty common. Yeah. So most people find it really difficult to get started. So hopefully today you might be a little bit inspired just to take some small steps to get started with exercise. And often it's really hard to know where to start, especially A, when you've been diagnosed with cancer, and B, if you've had surgery or undergoing chemo and those kinds of things. Marty, you've got a question? Or is that just a reaction as in you exercise? I think that might be what it is. Feel free to unmute if I've misinterpreted. All right, I'm going to share my screen. All right, so hopefully you can all see the presentation there. All right. Oops, what has happened to my view? Okay. So I'm on kind of a dual monitor, so I might be looking up every now and then just to see where I'm up to. Yes, exercise. Fantastic. Thanks, Marty. Okay. So an overview of today's talk is I'm going to talk a little bit about the benefits of exercise generally. Importantly, how you can be safe when you're exercising and things to look out for, and point you in the direction of some resources that you can access if you'd like to find out a little bit more about exercise or find out where you can exercise with some guidance from an exercise professional. So first of all, I just thought I'd start the presentation. This is a patient that I had a few years ago now when I was doing my PhD. And unfortunately, Derry's no longer with us, but he was a really strong advocate of exercise. And I think he was one of my first experiences treating someone with pancreatic cancer. And he had quite advanced stage pancreatic cancer and having really good outcomes with exercise. So he volunteered to be a bit of our poster boy for exercise, participated in a couple of articles and things that we did. So I thought I'd share a little bit about his story. So Derry came to us back in, I think it was 2000 and it would have been about 2016, I think, to our cancer rehab program. And this was back when I was working clinically as a physiotherapist as well as doing some research. And he participated in one of our research studies as well. And when I met Derry, so as I mentioned, he had quite advanced pancreatic cancer. He was given a prognosis of 6 months. But when he walked in, he was experiencing some fatigue, had become quite deconditioned, but he really loved playing golf. He was a bit of an artist and, really enjoyed those kinds of pursuits as well. He had quite significant peripheral neuropathy as well from his chemotherapy. So balance was something that he really wanted to work on. And so one of his goals was to get back on the golf course. I think he was still doing like 18 holes until his diagnosis and treatment. So our aim was to really build him back up to what he was, maybe not quite what he was pre-diagnosis, but at least get him to a level where he could participate in the activities that were meaningful to him. So he participated in our cancer rehab program for 8 weeks, and I will tell you a little bit more about how he went at the end of the presentation. So you can keep Derry in mind and even thinking about how that might relate to your own cancer experience, because I'm sure there's some side effects in there that he was experiencing that you may well be experiencing as well. So most of my patients come to me with fatigue. I'm sure you all have felt like this at one point or another. A number of other common side effects include that peripheral neuropathy, particularly common with particular chemotherapies that people with upper GI cancers will experience. Also, loss of muscle mass and strength is really common. So people undergoing chemotherapy can lose up to 30% of their muscle mass during treatment. So if you think about that, like that's a third of what you could normally be able to do. And that can translate into your everyday function as well. So these 3 effects are probably the 3 main ones that really stand out in my mind, that people with upper GI cancers experience probably the most. And the good thing is they are all things that are potentially reversible with exercise. So there were some guidelines and a lot of studies that were pulled together back in 2019 now that told us all the benefits of exercise for cancer. So a lot of this research has been pulled from breast and prostate cancer research, but more and more we're seeing this research being applicable for other cancers as well. So health-related quality of life. So people usually when they exercise, it goes without saying, just quality of life is better. People are able to do more, the things that they want to be able to do. Cancer-related fatigue, it's a bit counterintuitive, but cancer-related fatigue is the number one thing that exercise can help with, and it's actually the first line of treatment for cancer-related fatigue, which is, a bit counterintuitive to what people generally think. If you're usually tired, you would rest and then feel refreshed when you get up. But with cancer-related fatigue, it's a very different type of fatigue. As you may have experienced, it doesn't necessarily get better with rest, and it is very debilitating. It stops you from doing your general activities. And the things that make it different to usual fatigue is it's very multifactorial. So it's not just a physical fatigue that you haven't had enough sleep. There's inflammatory processes that are going on in your body. So you've got chemicals in your body that your body has made from the cancer that makes you feel more tired. There's a strong emotional component to it as well, especially if you're experiencing depression and anxiety. That can make a huge difference to people's fatigue levels. Obviously, sleep, a lot of people do find it difficult to sleep, especially if they're on steroids after a chemotherapy round. If you got poor sleep, you can't let your body rest and recycle. There's obviously the physical component as well, and many people also find it difficult to even think. There's this cognitive component that goes with cancer-related fatigue. So it's really multi-pronged. And the good thing with exercise is it targets each of those different systems. So not only does it build your muscles and it builds your lung capacity, it makes the oxygen more efficient going around your body. It also makes you feel good because you get endorphins, and especially if you're doing it with other people, you've got that peer support element as well. We know that exercise can actually stimulate your immune system to help decrease some of that inflammation as well. And it also helps you think a little bit more clearly as well. So even though exercise is really difficult when you've got fatigue, and there's certain ways that you can tailor exercise fatigue that I'll talk about in a moment, over time, that exercise will build up, that you'll have less fatigue in the long run. So anecdotally, patients that I have that start exercising earlier in their cancer treatment, whilst they still feel tired during their cancer treatment, they feel nowhere near as tired as people that I've treated that might not be exercising. So always good to kind of keep that in mind. We also know that, exercise is really good for mood. So reducing rates of depression is one of the strongest areas of research that we have. So the great thing is I often have people ask me, but I exercised before my diagnosis and I still got cancer. And I say, that doesn't matter, because when we look at the data, if you take a group of people who exercised before their diagnosis and then a group of people who only exercised after their diagnosis, the people who exercise after diagnosis still get just as much benefit, if not more. So as you can see on this graph, so basically the more exercise you do, which is going along the horizontal axis, and then the vertical axis is your risk of premature death. And there's a steep decline for the first, what we call 10 Met hours. So that's essentially the amount that you're doing. So after diagnosis, that drops off a lot steeper, reducing your risk, as opposed to those who might have only exercised before diagnosis. So this was one of the first studies to basically tell us that doesn't matter what you did before, it's never too late to get started. And there's a number of reasons that we think this might be the case. And part of this is when you're exercising after diagnosis, there's actually changes that happen in what we call the tumour microenvironment. So the little blood vessels and organs around the tumour that actually, and the inflammatory processes and the immune response actually attacks the tumour because of exercise. So we have a release of what we call natural killer cells that then our body produces to go out and detect the tumour. Also, another thing contributing to this is if people are having chemotherapy and they're exercising, they're getting a widening of their blood vessels, more blood flow to the areas of the tumours that can then potentially kill the tumour cells more effectively. So there are some cancer-specific benefits of exercise, as well as the general benefits that we know of, that we hear about all the time about exercise as well. So how much should we be doing? So in general, you've probably all heard at some point in time about exercising 150 minutes of moderate to vigorous intensity physical activity to maintain good health. So this is a general recommendation. It does also apply to people with cancer. However, the difference is we acknowledge that this might be pretty hard to do all in one hit, especially if you've just had surgery or you're undergoing chemotherapy. So basically, this is the end goal. But the good thing is that 150 minutes can be broken up into any way, shape, or form. So that constitutes a 15-minute walk on 6 days of the week. It could be 30 minutes of huffing and puffing exercise on 4 days a week, but it also could be more incidental activities like doing housework. So 4 hours of housework across the week, and this is hard housework like vacuuming and mowing the lawn, stuff that kind of makes you breathe a little bit heavier. that can also contribute to your 150 minutes. But we do also have some more specific guidelines that I'll talk about in a moment. Ooh, why is that not changing? There we go. So basically, our Peak Clinical Oncology Society recommends that almost everybody, I put the almost in brackets because we do acknowledge that there are some times when people can't exercise. For example, if people are at end-of-life care or if people are medically unstable, obviously it would be potentially unsafe for them to exercise. But that aside, most people can exercise at some point in their cancer journey. So this includes before surgery, if people are having surgery, during chemotherapy or radiotherapy, and after treatment. And the goals of exercise are a little bit different depending on where you are in this continuum or journey. So essentially before surgery, the aim of exercise is to build you up and get you as fit and strong as you can, so you can cope with that surgery better and recover faster after your surgery. And that's known as prehabilitation. And that's increasingly becoming more and more common, especially in the upper and lower GI cancer space, because we're seeing some really good outcomes from some of the research that's been done, that people are getting out of hospital quicker. They're also experiencing less complications as well. And they're getting back to the activities that mean the most to them sooner. So I think in the coming, 5 to 10 years, we'll start to see prehab become kind of mainstay for people with any kind of abdominal cancer. So watch this space. During chemo and radiotherapy is also a newer area of exercise and cancer research. So as I mentioned before, we're starting to get studies demonstrating how the exercise is beneficial during chemo and radiotherapy, and there's lots of physical and physiological changes that happen as a result of doing exercise during this stage. And usually if you're exercising during treatment, it's to maintain a level of function that you have to stop you from getting worse and not being able to do the things that you need to be able to do. So it's not necessarily about building up so that you can then go and run a marathon. It's just about trying to maintain what you can do until you finish treatment. But also acknowledging that some people with more advanced disease might be on chemo ongoing. And in that case, it becomes even more important to be exercising whilst they're having palliative treatment to maintain quality of life for as long and as best they can. And then finally, after treatment, which is where a lot of the research came originally, is basically trying to build people back up again. So lots of people traditionally, when being referred to exercise, they kind of did all their treatment, fell in a bit of a hole, weren't able to do what they wanted to do. It was a real struggle, even walking, for example. So then they'd get sent to rehab to build up their fitness and strength. And so at the moment, there's no best time that's recommended for people to exercise after cancer. And a lot of the research that we've done here at Eastern Health has really told us that patients should exercise when they're ready. But the messaging about the benefits of exercise should happen early and be a repeated, consistent message from the cancer team to ensure that when you are feeling like you can face doing exercise, that the support's there in place for you to be able to do that. So going back to before surgery, so I thought I'd just talk about this a little bit more. I'm not sure how many people on the line might be before surgery, but generally what we're trying to do in that prehab phase is we want to try and optimize your diet and physical activity. We particularly want to build people up as strong as they can so we can help mitigate some of those effects of losing muscle mass, which can be worse after surgery if you're experiencing a lot of pain and people stop moving because they're in pain, and then their muscles kind of deteriorate. Strength is really important. As physios, we also teach people about how to clear their chest. So when you're under anaesthetic for long periods of time, and people can have these cancer surgeries that go for hours and hours, especially if they're complicated. So basically, when you're under anaesthetic, your lungs go to sleep and they're not as good at clearing out any secretions that are in your chest. And so many people will develop phlegm after surgery. If that phlegm stays in your lungs, then you're at risk of developing a chest infection. So we teach people beforehand of how they can clear that phlegm, either by coughing using a pillow to help with pain relief if someone's got a big abdominal wound, or by using another technique called huffing, which is a little bit more gentler on the tummy, which basically involves making a O shape with your mouth and huffing out like you're blowing through like a little hole or a toilet roll, which doesn't sound that great. So like a kind of movement, I suppose. So that's a huff. We also aim to make sure your home environment is set up in a way to make things easier. So you might move things around to ensure you're not having to bend down into low cupboards or lift things that are heavy from a low height, because you'll be told to avoid heavy lifting after surgery. And we also want to ensure that we psychologically prepare you for surgery as well. And so giving you mechanisms for stress management and mindfulness as well. And then for after surgery, which there may be a few of you on the line who have gone through the surgical process. So in the very early phases as physios, we make sure people get their body moving as soon as they can. So usually starting out with just pumping your feet up and down, which can also be really helpful if you're at home and you find it really hard to get moving, to at least get the blood pumping if you're spending a long time in the chair during the day. We encourage people to take deep breaths for that movement of any phlegm buildup in your lungs. We get people to get out of bed as soon as they can. So we ensure that people have good pain relief before they can do that. So even if this is just getting out of bed on that first day. Usually there's a lifting restriction, which can vary a little bit from surgeon to surgeon, but it's generally for the first 6 weeks. There'll be no heavy lifting of anywhere between 2 and 5 kilos for that initial period, just to make sure that all those wounds heal and we're not at risk of developing any hernias or anything like that. And then we gradually like to introduce core exercises, as often, when you're getting cut down the middle, you're getting essentially all those muscle layers are cut through as well. So we gradually like to build up those deeper core muscles that support you when you're sitting and when you're moving and doing activities. And starting with big muscle groups, so like our butt muscles, our thigh muscles, before we move on to smaller groups. So starting off with really functional type exercise, like standing up and sitting down from a chair or lifting your bottom up and down from the bed, can be really beneficial as a starting point. So when we look at the guidelines a little bit more closely, we have some more specific cancer exercise guidelines, and these are to target specific problems that might arise after cancer. So we recommend that people are doing, again, a moderate intensity exercise, so huffing and puffing a little bit, getting a little bit of a light sweat on, but you should be able to still hold a conversation as you're doing this type of exercise. And starting with cardio exercise, so any walking is the best one, but can also include swimming, although you're probably not doing swimming if you're within 6 weeks of having surgery. It could be cycling, it could be dancing around the lounge room, it could be boxing, anything to make you huff and puff. And that's recommended to do that 3 times a week, building up to 30 minutes per session. So this really targets your cardiovascular fitness. This type of exercise is really good for cancer-related fatigue quite specifically, as well as just your general function and endurance during the day as well. The other thing we recommend is strength exercise, which I can't kind of iterate enough how important this is. So 2 times a week is all you have to do for strength, because we want to allow people to have some time to recover in between sessions. So generally we recommend do a session on, a session off, then another session on, and then a couple of days off. So when you do any kind of strength exercise, it causes little micro tears in your muscles, which then allow new muscle filaments to build over those tears and basically build new muscle. And that's the kind of pain that you might feel after doing an exercise session. So often, particularly if you've been doing a pretty hard exercise session, you'll feel pain the next morning, and then maybe even the second day after, it will feel a little bit worse. You feel that kind of dull ache over the muscles that you've been exercising. That is usually a good sign if you've been doing strength training, because it means your body is adapting to the changes from the exercise. So usually I recommend, if people have started an exercise program, that they might feel a little bit stiff and sore for the first couple of days after. That's normal. But if it persists, then definitely go and see someone about that. So a simple strength exercise is literally standing up and sitting down from the chair. So if you're feeling a little bit itchy to get up, and we've been sitting now for about half an hour, feel free to stand up and sit down a couple of times, and you'll notice that you can really feel it in your thighs and your butt muscles. So this is a good substitute for squats, especially if you get sore knees like I know I do. It's a little bit more comfortable to do as well, and you're more likely to use the right technique with something like sit to stand. But other strength exercises that you might do are like standing by the kitchen bench, going up and down on your toes, particularly good if you need to get the blood pumping in your calves. The bottom lifts off the bed, like I mentioned before, are a good one. Anything where you might have to kind of lift and carry up and down, bicep curls, push-ups. So often I don't get people doing push-ups on the ground, but I'll get them standing against a wall to start with. You can monitor how much body weight you're doing by how close you're standing to the wall as well. So in terms of building up exercise, if you can, start with about 10 minutes per day. Some people might only be able to tolerate a little bit less, and that's okay. You just do what you can. And I'm sure we've all heard about the 10,000 steps per day. You can throw the 10,000 out the window if you've got any kind of chronic disease, including cancer. Some more accurate studies have shown that about 7,000 steps is all you need. So aiming for that 7,000 if you can. And usually a half-hour walk will get you about 5,000 steps a day. So if you can get your half-hour huffing and puff exercise in, and then your everyday activities around the house and going out to the shops, that should get you to about your 7,000 steps. All right. And one that I think is important that people might not think about is not spending long periods of time sitting. So avoiding inactivity, which is a little bit of a different concept to exercise, but still can have a big effect on your body systems. So especially in those early phases after surgery, if you've had surgery, or if you've had a round of chemo and you're feeling pretty shocking and you might not be able to do anything else, then you can simply just stand up every now and then. And just by standing up, you're going to expand the lungs in your chest, so you get more oxygen in going around your body. You'll notice that you can take deeper breaths. So even if you practice slouching in the chair trying to take a deep breath, it's really hard. And if you just stand up, you'll notice that it's a lot easier. You also have to start activating your muscles just by standing up and not even doing anything else. So if all else fails, set a timer for every couple of hours to make sure you just have a stand up, stretch your legs, and it'll be good for your lungs, good for your muscles, and can prevent you developing cardiovascular disease, as well as any other more metabolic diseases like diabetes. Now, how do you monitor yourself so you know you're doing the right intensity? We usually use a few different methods to do this. So the first one we do is the talk test. So basically, if you can talk in short sentences, you're good to go. If you can hardly hold a conversation, you're probably working too hard. And if you're able to sing, it's way too easy. So you want to be in that middle point. We also use what's called a modified Borg scale, which basically is just a rating of how breathless you feel. So we usually get people to, when they're exercising, we show them this chart, and we want them to exercise anywhere from moderate to severe in terms of their own perception of how hard they're breathing. So it shouldn't be feeling like you're dying, but it also needs to be more than just, you know, a slight puff and a blow out of a candle. So just for the last little part, I thought I'd just tell you a little bit of how you can modify exercise. So the first one is for fatigue. So obviously the more fatigued you are, the harder it is going to be to get going with exercise. So start off with something that is familiar to you. If you've exercised in the past, start with those kinds of exercises, or you might be starting with the more functional exercises like the sit to stand, for example. Generally, we recommend you gradually increase the amount of times you do it throughout the week, and then the amount of time that you do it in one go. So, for example, you might start off with 5 minutes and then you'll push that out to 10 minutes. And then the last thing that we change is the intensity. So you might be just doing light activity, just a very casual stroll to the letterbox 5 times a week. It takes you 5 minutes, and then you might do more laps. But eventually, as you start to feel fitter and stronger, we'll get you doing a longer walk, and we'll get you doing it at a faster pace. So particularly if you've got high levels of fatigue, it is good to see a professional just to get a better idea of what your base level is, and then we can track it more closely to modify up and down. And if you have really severe fatigue, we'd only be aiming for 10 minutes tops at a more low intensity and doing more general exercise as well. So anything that we can do to just get you moving, basically, until you can get to a level that you can work a little bit harder, because it all does count. For those people who might have more advanced cancer and have cancer that's spread to the bones, we recommend definitely seeing a physio or an exercise physiologist, so we can make sure you're doing movements that are safe. But in terms of general recommendations, we get people to avoid anything that's impact on the bones, so any running and jumping. We recommend more functional exercises where we're using large muscle groups and multiple joints. You can use weights, but generally it's just not over the affected part of the body. So, for example, if I've got someone who has bony disease in their upper arm, I wouldn't be getting them doing bicep curls on that arm, but they can still do bicep curls on the other arm. They can still do leg exercises. So it doesn't mean that weights are out full stop. It just means some weights we can do and some weights we can't. And really important is to ensure a safe environment to avoid falls. So especially if you've got some balance issues, peripheral neuropathy, making sure you're holding on to a kitchen bench or a chair or something like that to do your exercise as well. And finally, peripheral neuropathy. So again, just making sure you're safe. Balance exercises can be really beneficial. So we know that by integrating balance exercises into people's routine, we can prevent them from falling, make them a little bit steadier on their feet. We might not necessarily ever be able to change the sensation that you feel from your peripheral neuropathy. So there might always be a numbness or pain there. But there is some anecdotal evidence that doing balance exercises and using, like, rubbing different surfaces on your feet and exposing the areas that are affected to different surfaces and things might help. So it's definitely not going to hurt. So you could try that. And then the other things are more just to avoid falls as well. So wear glasses if you need them, and avoid bi or multifocals if you are at risk of falls. So bifocals and multifocals are terrible for, like, changing your depth perception. So we usually recommend people have multiple pairs of glasses. Making sure you use mobility aids if you need them, and really good supportive footwear that's got a really strong heel, strong front, that you can't fold the shoe too much in half and it's not flopping around on your feet as well. And the more supportive it is, the more it'll feel better on your foot. Also, some people are so sensitive that they can only tolerate certain types of shoes. So Skechers and anything with memory foam in them can sometimes feel a little bit more comfortable than your standard shoe. So in terms of other tips, just remember to start slowly. I've already talked about the muscle soreness that you might feel. That's okay. But anything else that's a bit sharp, or you're getting night pain or anything like that, see a professional. Exercising with others can sometimes be useful to maintain motivation. If you're going out on your own, some people feel safer if they're just carrying their phone with them. Particularly if you're having chemotherapy or you're early post-op, it's a good idea to make sure you're just doing good hand hygiene and preventing the germs. And most importantly, try and find something that you can have fun with and that you'll enjoy, because that's the type of exercise that you'll continue to use in the long run. If you do go and see a physiotherapist or an exercise physiologist, what you can expect is we'll ask you a little bit about your cancer history and any other medical history, what side effects you're experiencing at the moment, what you're able to do now compared to what you used to be able to do. We also might ask about other things such as diet and sleep and refer you on to the appropriate practitioner if you need it. We'll also check your blood levels. So if you're anemic, for example, so you've got low hemoglobin, less oxygen going around in your blood, we're probably not going to be getting you to do really intensive exercise, and it might be more gentle movement, or we might have to stop exercise completely until your blood levels recover. And we usually do some physical tests. So we often do what's called a 6-minute walk test with people to get them to walk as far as they can in that short period of time, which gives us a bit of a baseline of how much people can do within a session. And we'll do things like taking your blood pressure. We might test you out with a few different weights just to see where your base capacity is. And what's really important is to know when to stop. So if you're getting any untoward extreme fatigue or tiredness, especially if your bloods change, definitely need to stop. Any changes in your coordination or balance could indicate something that's neurological that's going on. Certainly if you're dizzy or fainting, if you have a fever, don't exercise, or just feeling unwell. Any chest pain or in your arms, stop and call an ambulance. Especially if it's associated with severe shortness of breath. And if you're getting any new nausea, vomiting, severe diarrhea, you probably don't want to be exercising either. So finally, just some resources of where you can find someone who can help you to get started with exercise. So on our Australian Physio Association, we have a Find a Physio site. Similarly, with exercise physiologists, ESSA also have a website where you can put in your location. You can usually select cancer, and it should find people who have familiarity with people with cancer. You can also get a GP care plan where you can get 5 Medicare subsidised visits with a physio or an exercise physiologist to get you started. And some of the private practices also offer exercise groups as well. Otherwise, sometimes it is a bit cost prohibitive to go and see someone privately. So there are cancer rehab programs that are run through some hospitals and also out in the community. So it does vary. So my hospital runs both a telehealth exercise program, which currently doesn't have a waiting list at the moment. So if you like using telehealth, you're all on Zoom, you can definitely get in touch with our telehealth program at Eastern Health. And that's based at our Hillsville Hospital. So that's communityhealth at easternhealth.org.au. But we also have a face-to-face program as well that runs at Wantirna. So the Cancer Exercise Toolkit that Alison mentioned at the start of the presentation, that has some locations of more community and hospital-based services that you can access as well, depending on where you live. I was going to get everyone to do this activity, 50 reasons to exercise, but I think we're probably running a bit tight on time because we had some tech issues. So as you know, once you jump off the line, a little bit of a think about why you might want to exercise. I used to do this activity in my rehab class, and we would come up with all weird and wonderful things, including things like being able to go to the toilet better, using your pelvic floor, being able to play with the grandkids. You can get creative with finding what really would spark you to do exercise, and that can be a good way to kind of find your motivation. So finally, just looping back to Derry. So after he finished our program, he went back to the golf course. He ended up joining a local exercise physiology practice gym. So he was going like 3 times a week, and he went religiously up until 2 weeks before he died. Or it might have been 6 weeks, but anyway, he was pretty much going the whole time. He increased his walking test results just in that first 8-week period quite significantly by at least 30 metres, which is what we would say is a significant result. His balance improved out of sight. So I think he went from doing about 13 taps on a step, which kind of indicates borderline falls risk, to being able to do about 21 on each side. And he didn't have any falls whilst we saw him either. So he was a real success story. He ended up, his initial prognosis was 6 months. He ended up living beyond 2 years from that initial prognosis, and a really good quality of life as well. He was doing all the activities that he wanted to be able to do. So I think Derry was a bit of an inspiration for our other patients that were in the program, and certainly for anyone else who might be experiencing pancreatic cancer or something with a little bit more of an advanced diagnosis. So hopefully what we've discussed today has got you a little bit inspired to exercise, and just reiterating that exercise is safe. You'll have all sorts of benefits from exercising, and even just a little bit can help. So if you're not sure, get online, see where your nearest physio or exercise physiologist is, and they can hopefully tailor something to your needs. So, yeah, we can open it up to questions.
Hi, it's Andrea here. I've developed a frozen shoulder,
Mm,
and I have been to a physio for 5 sessions, but I didn't feel I got a lot out of it.
yep.
So I'm just really am not sure where to go from here.
Yeah. Are you doing any exercises to help move the shoulder? Did they give you anything to do?
Oh, look, there were only a couple. They weren't. Oh, there was one to try and it's on the bicep. So
Yeah.
it sort of did one to try and extend the bicep back a little, but then that started hurting. He said, don't do it. The other one was to try and get my hand behind my back.
Mm.
They were the only things. I didn't get anything else.
Yeah.
Yeah.
So a frozen shoulder are notoriously painful and frustrating to manage. Sometimes a frozen shoulder will resolve on its own, but sometimes you do need some extra management. So I would potentially go see a different physio if you can. And they can take like a good 3 to 6 months to really resolve.
Yeah.
You might need some other things that they do for a frozen shoulder, like steroid injections, or what we call a hydrodilatation, where they basically...
I've actually got a referral to have that done. I haven't done it yet.
Perfect. Yeah. So it's great that referral's already in place, and usually that's pretty effective.
Good.
Especially if you combine it with physio after you have that. So yeah, I probably can't provide any specific advice on your shoulder, but I think in the meantime, while you're waiting for that referral, I wouldn't give up on doing your exercises.
Yeah, that's what I wasn't sure of, how to approach exercises with this shoulder like that.
Yeah. So usually we recommend doing whatever you can within an acceptable limit of pain. So around a 5 out of 10 feeling. But if you're getting really, really severe pain, you're not going to be pushing through that. The main thing is probably try not to avoid using your arm altogether, because that's just going to make a frozen shoulder worse.
Yeah. Okay, thank you. Yeah.
Anyone else?
Sorry.
Hello.
Sorry.
You go first.
Is it me?
Yeah.
Yeah. Well, apologies for arriving late for one. And I do feel like a bit of a fraud being here, which you'll find when I tell you what my question is. I was diagnosed with esophageal cancer 4.5 years ago. Long story short, it came back in my, I think, thyroid, and then recently it came back in my liver, and I had a liver resection. And in a nutshell, I feel like I've been in the ring with a gorilla for about 4.5 years. And I've got no defense other than, whenever I get knocked down, as I start to feel better, I've got to remotivate myself and, get more physically active again, and etc. So since my liver resection, which prior to the liver resection, I was traveling incredibly well, had my diet just perfect, which I'm about to start reworking on because I've gone off track there, and was walking very regularly. The bit where I feel like a bit of a fraud is when I tell you what I want to do, which is I'm on an acre and I'd like to get a dirt bike and build a kind of a little, called a trials course. It's not for speed, it's more for balance and, mentally challenging. Because I've never gone to the gym. I've always found it very difficult to exercise for the sake of exercise. But an exercise regime like that would be very motivating for me. It would be easy for me to go out and do that. So my problem just at the moment, though, is just I find it so hard to motivate myself to going again. It all comes under the category of motivation, which I'm kind of, it concerns me because I feel like I'm getting to that point of move it or lose it. And if I don't get myself going soon, I'm going to get worse. I'm nothing like what I was physically before cancer. So I don't know if there's anything you can tell me about, getting motivated or how to, or any resources or help that can.
And look, that's
motivated.
So common. And people often can see the end goal and they just don't know how to quite get there. And that's where sometimes just seeing an exercise professional to give you some hints about the steps that you need to take to get there. Because I can imagine, like, if you're getting on the dirt bike, you're going to have to need, like, good core stability, for example, and leg strength to stay on the bike.
And arm strength,
exactly. So a skilled exercise physiologist or physio would be able to give you some exercises that are more specific to the activity that you want to be able to do, rather than just here's the Cancer Council booklet and do these random exercises that you might not feel like doing. Also, people that come to my rehab groups, and they're often not exercise people and they don't like exercising with other people or going to the gym, but just being in that environment and being with other people who are in the same boat, again, can be that little bit of a kickstart, like 6 or 8 weeks. And then, okay, I know the tools now. I can go off and do it on my own. So sometimes just having a little bit of accountability, whether it's through a professional or through peers, can help. Integrating little things into your routine as well. Like if there's certain activities that you've done in the past to help you with your upper body strength with getting on the bike. You might just pick 1 or 2 exercises and make a habit of them, and you might choose that you're going to do it on Tuesdays and Thursdays and make an appointment in your diary or put it on the calendar just to get you started. And then if you're doing it at the same time, every week, you're more likely to continue that and build on that. And also just knowing what it is that gets you out of bed and why you would even want to exercise. And for you, it sounds like you love getting out on the bike. So having those goals can be motivating in and itself. So it sounds like you're really in this borderline phase that that you want to exercise, that it'll be helpful. You just need some practical steps to get you to that next level.
Yeah, I think when I say I feel like I've been in the ring with a gorilla for so long, I think the thing that concerns me, and I'm sure I'll overcome this, but I almost feel like I'm kind of going, oh, I give up. I've been beaten around too many times, and I don't want to feel like that because I know that's very dangerous. So I've got to get over that. But just doing this today is motivating in itself. I've looked up with your cancer toolkit. I saw that it was Rosebud Community Health was my nearest, and I've done cancer exercise programs with them, but I hadn't thought until right now that, oh, all right, I might drop back because I kind of feel like, oh, well, I've done that. But I guess there's no reason why I can't drop back in and say, hey, can I revisit this because it was useful and maybe they'll let me do it again. I don't know. So, yeah.
Yeah, and especially when you have had major surgery, like you've had the liver resection, usually these programs will accept you back on. And we know that people cycle through different phases. There'll be times when you're really good.
That describes it. Yeah.
And then you have something that happens like surgery that knocks you off, and then you've got to start again. And I know the girls out at Peninsula Health are really great at being able to tailor exercise. So if that's your nearest, that might be your first point of contact to get you back and going. Yeah.
Well, if nothing else, doing this morning has kind of probably sparked that where I think I'll go down there and at least talk to them and see. Yeah.
Yeah, exactly.
Yep. Thank you.
And Di?
Okay, hi. I sort of have 2 questions. I've just, in the last couple of days, actually just got some results back. So it's sort of cancer related, but not in a way. Some results back to do with osteo.
Yes.
So my first question, and they're not good. My bone density, thing is down. First question is, does chemo have an impact on your bone density as well as other things, and is that what could have made it worse?
Yes, definitely.
Okay. Okay, all right, thank you. It's just something to know if I have to go through that again and just to be aware of. And also I've been recommended to go on some prescription, either injections or tablets, which I would prefer not to do because of the side effects of it. Of what I've heard. So I'd like to really avoid that if I can. But I just wondered whether you talked about exercise helping bone health. Does it help build density again? Can it?
Yeah. So it often is hard to rebuild bone density, but you can certainly prevent it from getting worse.
Yeah.
So, but we do know, like in men with prostate cancer and women who are on long-term hormone therapies, that actually by doing A, strength exercise, but B, what's even better is the impact exercise.
Okay.
So, if you don't have disease in your bones and you're pretty steady on your feet, things like skipping, hopping over little hurdles, or even just jumping on the spot, like doing squat jumps.
Oh, okay.
That actually, that impact on the ground is what causes new bone to form. So you actually can, depending on what all your other medical conditions are, you can rebuild bone with impact exercise.
Right.
But I would definitely recommend doing that under supervision, because the problem is
Yes.
that sometimes people are like, yes, I'm going to start this, and then you might get other musculoskeletal problems. So you might
Yes.
pull a muscle or hurt your knee or
Yeah.
something like that.
Yeah.
So yeah, depending on what the rest of your general health state is like, it's definitely worth getting into strength training to start with. And
Yes.
potentially some impact training as well is really good for preventing osteoporosis.
Okay. All right. Thank you.
Yeah. Anyone else? Yep, Brett.
Yeah. Just hi. How you going? Sorry to coming in late, but my question is probably around chemo, and I've just finished my final course 2 weeks ago. I was supposed to have another course yesterday, but the last day put me in hospital, and they had to sort of stop the treatment there. But my background, I was diagnosed in August last year with stomach cancer and had 4 rounds of chemo through October to December, had a break and had a subtotal gastrectomy where they took 80% of the stomach out in January. Before that, I was very fit. I've always been an active sportsman. I could still compete competitively in surf lifesaving and athletics. So I had a good base. I was competing 4 weeks after surgery, which was pretty fast track sprinting. And then I did my state championships and I got sick again with stomach problems and missed out on my Australian championship. But I've got worlds in 2 months' time. So my question is around the chemo. And I just had a sprint session this morning and I felt I still got a little bit of mild peripheral neuropathy there in the feet. But I guess my question is, I've got a 2-month time horizon to train. How quickly does chemo leave the system? And your thoughts? Yeah, so my base is still pretty good. I've trained every day through chemo, had no fatigue. Setbacks have really just been around the gastrointestinal stuff, which they said would be harder the second time round. So yeah.
Yeah, look, in terms of just general advice, often I think it can sometimes take about a month or so once you finish chemo. And in terms of exercise generally, it takes about 8 weeks or so to build new muscle and things like that. So 2 months is definitely a time frame that you could still make improvements for sure. And if you've been training, consistently, that should make it easier for you to bounce back. But probably, your oncologist would be able to give you a better idea in terms of chemo-related questions to that higher level exercise. But yeah, if you've had a consistent base, and depending on what happens with your chemo next, you can definitely continue to make improvements.
Yeah, that should be the end of the chemo now. I've had some atrophy, obviously, through that period, but especially with the hospital stays where you just sort of nil by mouth and liquid diet, that knocks me around big time. But I bounce back pretty quick, and I do all that stuff. Like I do some weights, and a lot of plyometrics and stuff like that. So it's been an up and down battle, but I keep fighting away, and hopefully now the chemo's over, I'll have a smoother path and stuff.
Yeah, and that's often what we notice is once people finish their chemo, life becomes a little bit more consistent as well. So it's a little bit easier to train at the level kind of that you need to, and you can make quicker gains because you're not bouncing in and out of hospital and things like that. And the other thing that I just consider, which I'm sure you're all over as well, is making sure you have adequate protein intake as well.
It's challenges just with that smaller stomach is just to get heaps of fats and protein. Yes.
Yeah. Well, good luck.
Thank you.
All right. Is there anyone else that's got any burning last queries?
Yeah, Jan Stuckey here. Sorry, I'm just out of hospital with pneumonia, pleurisy, and RSV. I was diagnosed with pancreatic cancer just under 2 years ago. I've had surgery followed by chemo, followed by major Whipple's surgery, followed by more chemo. So I do feel very grateful I'm here because I'm apparently cancer free.
Yes.
But I guess what I'm asking is, given I'm pretty cook. I'm just wondering how to edge back into some exercise. Given my breathlessness, I do live in a 2-story house. I live on the beach, so I do go up and down the stairs, and I do. Yesterday, I went to the beach and got knocked out by a wave, and decided I probably shouldn't be doing that yet.
Yeah.
But I'm just looking for a bit of guidance, because I got no advice at all for exercise post surgery.
Yep.
And as you know, Whipple's is pretty major.
It definitely is.
A whole lot more than half your stomach. It's more than half your stomach. It's a bunch of other organs too. So, what would you suggest how I can ease back?
Yeah, and look, it sounds like you're already making a good start. So, definitely, like, I usually recommend just get started with walking. And it might be. And if you've got stairs in your building as well, that can be a good way to kind of monitor your progress as well. So, if you are going up and down the stairs, you might do it twice a day, twice to start off with. And then you might, add an extra up and down as you're feeling fitter. If you're going for a walk around the block or a walk along the beach, you might time yourself and see how far you get. So if you're going around the block or on the street, or I don't know if there's other houses along the waterfront, you can find a marker, see if you can get to there. And then, the following week, see if you can get a little bit further, and use that perceived breathlessness as a guide. So you'll be feeling quite short of breath, like you've mentioned. So as long as you feel like, you could talk to someone if you were walking with them, or if you can hold a conversation, that's okay. And even if you need to stop and have a standing rest every now and then, that's okay too. So I would use that marker of feeling like you're about a 3 or 4 out of 10 in terms of breathing heavily. I would probably also just try and get a little bit of strength stuff in as well. So consecutive, I keep banging on about the sit to stands, but it really is like a really good exercise. So
I know it is. I know. I think what we didn't cover though before, when you said about the key things with fatigue, nausea and so nausea and with your balance sort of stuff. I mean, they're really big ones.
Yep.
But so is brain fog. So I've tried to start doing chair yoga and stuff, but the memory won't allow me to. I have to write everything down and look at it all the time, and this has just set me back. I mean, I was very unwell, and it came on very quickly.
Yeah, and I think don't be too hard on yourself as well. And this goes for everyone. If you feel like you're not doing what you should be doing, because it's okay. Your body kind of does need a bit of rest and recover, especially if you've just had pneumonia and RSV. Like, you don't
and pleurisy,
you don't want to be pushing your body too hard, because your immune system is just trying to recover. So that's why we often just recommend with the walking first, and chair yoga sounds like a really good starting point as well. There's also some really good video exercise resources as well, that go through different levels of exercise. So you might be starting at kind of that lower level, given that you've just been in hospital. So on our cancer exercise toolkit, there's a patient resources tab. And then I think down the bottom, there is some links to some videos. And there's a program in Ireland, actually. It's called Perks. And I'm pretty sure the link is on my cancer toolkit, where they have different levels of exercise, like a beginner, an intermediate, and a higher level, where you can follow along with it just at home. And the good thing with doing that is you can kind of just stop after 5 minutes if you feel like that's when your breathlessness is getting too high. And I would also see, Jan, if you could link into a local health professional. Can I ask where you live? Are you down on the peninsula?
Yeah, I live on the Gold Coast. I'm married to a GP.
Oh, you're in Queensland.
I'm married to a GP, and he had an aortic dissection, which was not too good. So we've both been, So it's just the support services just aren't there. And I think often if you're a private patient as well, you really seem to be out there. That's why, you know, I value Pancare so much.
Yeah.
And sort of like the services that they give. Your presentation was amazing. It was just so sensible and so balanced. I guess I'm coming up to 2 years on the 1st of July, which is a big cause to celebrate.
Yeah, definitely.
But I just feel like my immune system is crap, and I'm looking that maybe my exercise is wanting a bit more.
Yeah, and
I'm lacking there. That's what I'm feeling, and I know I'm not being hard on myself, but I'm feeling. I'm really feeling that that's been letting me down.
Yeah, definitely. And up on the Gold Coast, we just called a bunch of hospitals up in Queensland to find out about whether they had programs, and I'm pretty sure the Gold Coast did have an exercise fit, like the Gold Coast Public Hospital did have as part of their cancer centre an exercise physiologist or a physio there. And even if you're a private patient, you can often sometimes link back in. Like I know our services in Victoria, you don't have to be an Eastern Health patient for us to accept you. They often do accept self-referrals. So
they are far away. I mean, John Flynn Hospital is amazing. It's part of Ramsay. It's only a few minutes. I don't want too much of your time because I understand we're pushing. But I do belong to a cancer group. There's 780 women. They're nearly all breast cancer here on the Gold Coast line. So there's markets for it. I mean, there are people who, you know, I mean, I just feel left out because I'm pancreatic and they're nearly all breast. And you do have pretty invasive stuff happen to you, which is different. And this is usually different to
and
this.
the other thing as well, Jan, I don't know if you're aware, and Alison, if you've mentioned this in previous groups, but Pancare will fund a single session with a private physio or EP. So you could potentially use that to just get them to give you a program that you can then do at home as well.
And also the GP management plan, which you mentioned before, Amy, is available to everyone as well. So for subsequent
I've got one of them, but I needed it for physio. I've got a lot of side effects and things, but I'm really grateful. So thank you for sharing. I'm sorry I'm not showing my face. I feel like crap.
No, that's fair enough. And hopefully, check out the website and see if there's any resources on there that might resonate with you. And, you know, if you do have the opportunity to get in touch with a private professional or someone through the hospital, that would always be my recommendation if you've had a hospital admission, because the hospitals should actually, like if you're in the public system here in Victoria and you're that, you know, deconditioned by the sounds of it, they should be organising physio for you to come to the home, essentially. So, and it's unfortunate that we have to self-advocate a lot. But there are services that are available within, the public health system that you might be able to link back in through your GP as well. Because, having that professional guidance when you're that unwell and that many side effects, we really do recommend having some supervision from a professional.
Thank you. Thank you so much.
No worries.
Thanks, Amy. That was a fabulous talk. And certainly if anyone's got any other questions, you can email through to us at support@Pancare and we can help you navigate that. But thank you very much, Amy, for joining us today. It was a great session, and this has been recorded so we can share it all with you once that's available.
No worries. Thanks for having me.
Thanks.